Right. Good morning, everyone. I hope everyone can hear us. Um, Good morning, good afternoon, or good evening from whatever part of the world you are joining us. Welcome to this information webinar coordinated by the CVD Secretariat on the Global Action Plan on Biodiversity and Health. My name is Marianela Araja. I am the Program Officer at the CVD Secretariat working on biodiversity and health, and I am joined today by other colleagues from the CVD Secretariat, but also by speakers from other organizations and initiatives that have kindly agreed to share their time with us today. So this webinar responds to a request from the Conference of the Parties, pretty much to the last decision on biodiversity and health that was made at COP16 in Colombia in October last year, where the parties requested the CVD Secretariat to collaborate with other organizations and to conduct capacity building activities, among other things, to support parties and stakeholders and indigenous people and local communities in the uptake and in the implementation of the Global Action Plan on Biodiversity and Health. So this is pretty much the webinar is meant to be the first activity to respond to this decision. And if I may also say, it is one of the several efforts that we're doing from the CVD Secretariat to network and connect and interact with other organizations and initiatives that are also working and active in the field of the nexus between biodiversity and health. So just as a brief introduction, this is informal, so we don't have a formal opening, but just as a brief introduction for today, we have a full agenda, and we will start with a brief introduction of the Global Action Plan on Biodiversity and Health that was adopted under the CVD, and a little bit of context of what is happening at the CVD, and then that will be followed by presentations from different speakers from organizations like the Wildlife Conservation Society, the World Health Organization, the Nature for Health Initiative, the Nature Conservancy, the Society for the Conservation of Nature in Liberia, and also from IPES. So with this brief introduction and in the best interest of time, let me just thank our speakers for once again for agreeing to be with us today. And thank you all the attendees for your interest in this topic. And I will just then get started with the first presentation of the day. If you allow me 1 second, I will start then sharing my screen. So as I mentioned, the first presentation, it's meant to set the scene for this webinar. We're going to be presenting the Global Action Plan on Biodiversity and Health that was recently adopted by the Conference of the Parties of the CVD last October, November in Colombia. So, but before I go and present the action plan itself, I just want to start by saying that the discussions on biodiversity and health under the CVD are not new. Actually, the importance of the connection between biodiversity and health has been recognized over the years, and a reference to this nexus and those linkages have been present in many CVD decisions, including decisions from other areas of work. And then more recently, we have had standalone decisions on biodiversity and health. And that shows the growing interest from the parties of the convention on this topic, and and shows also the interest from the general public on this. Now, I'm not going to go into details about all of those decisions, but I do want to highlight that even the decision on the Global Biodiversity Framework recognizes the importance of these linkages. So if you are familiar with the GBF, the Global Biodiversity Framework, you will know that it has goals, it has targets, but it also has Section C. And Section C is the section that considers the considerations for the implementation of the framework. So within Section C, actually, the importance of the interlinkages between biodiversity and health are acknowledged by the framework, and also the importance of the One Health approach is also recognized among other holistic approaches that are, for example, based in science and that help us to mobilize resources and actors to work together and that aim to sustainably balance and optimize the health of people, animals, plants, and ecosystems. The framework also recognizes the need for equitable access to tools and technologies, including, for example, medicine, vaccines, and other health products related to biodiversity. So before I start with the plan, then I just wanted to say that these are two things, like the previous work that had taken place under the CBD, and of course the clear message about this connection that comes from the GBF, were two things that inform the development of the action plan that we have adopted now. So what is the action plan then on biodiversity and health? It's a plan that recognizes pretty much that the health of the environment and the health of all species are interconnected and interdependent. And the main objective of this plan is to support parties and stakeholders in mainstreaming these linkages into national policies, programs, accounts, and also it's very important to say that the plan also recognizes that this needs to happen in line with national circumstances, because different countries have different circumstances and priorities. And also it needs to happen in a manner that it's consistent with relevant other international obligations, and not only those under the CBD. And the reason for that is because the plan, of course, recognizes that the cross-cutting nature of these linkages implies that many actors are working on this together. So we are working on this from the CBD side, but also other organizations and initiatives that you will hear later today are also very active on this. So when we talk about the linkages between biodiversity and health, they can happen in agriculture, they can happen when we talk about consumption, they can happen when we talk about biodiversity conservation, they can happen when we talk about climate change or invasive alien species. So this is why we recognize that no single actor can do this alone. And therefore, the plan also is aimed at enabling collaboration among government authorities that are active on those areas where there could be a connection. I also want to say when it comes to the plan and how it is anchored and structured, I think one of the main things to highlight is that the plan recognizes the right to a clean, healthy, and sustainable environment for present and for future generations. And also some of the things that are recognized by the plan, you will see that are related to, for example, the importance of sharing benefits from the utilization of genetic resources and digital sequence information on genetic resources for the achievement of a more equitable health system. For example, that biodiversity is an environmental determinant of health. The plan also recognizes the relationship between biodiversity loss and the emergence and spread of communicable and non-communicable diseases. That biodiversity loss also contribute to health inequities, and this is very important, especially for people that are in vulnerable situations, right? Like women, children, youth, or indigenous people and local communities. And that biodiversity loss and negative health outcomes share many common drivers. And this is something that we can use in our favor to work together in addressing those drivers and achieve co-benefits for biodiversity and health. So in terms of the structure of the plan, pretty much the plan proposes voluntary actions to mainstream biodiversity and health linkages. And among those actions, we can find general actions that are meant to be like this overarching framework for the plan, and more sector-specific actions. So for the general actions, you will see that it touches on topics such as the importance of knowledge sharing, cross-sectoral coordination, intergenerational equity, policy coordination, and mainstreaming. And then when it comes to the sectoral actions, they are framed in a way that they are aligned also with the Kunming-Montreal Global Biodiversity Framework. And that is done that way because we thought that, parties are very busy now implementing the GBF. It's a big commitment. And therefore proposing entry points for mainstreaming biodiversity and health linkages in a way that it's already coherent with the GBF, we were hoping could be useful for parties in doing that work. So for example, if you are working at a national level on issues related to land and sea use, species management, or the nature contributions to people, or consumption or agriculture, or pollution, then you will find on the action plan potential entry points or voluntary actions that you can consider to mainstream these linkages when we are working on those thematic areas. So this is just an example of how these these voluntary actions look like in the action plan. So if you see, for example, for an area like land and sea use that is related to targets 1, 2, and 3 of the GBF, you will find a column in the middle that it's giving you a rationale of the linkage with health. And then you will find in the last column voluntary actions that can be followed by parties and stakeholders to mainstream these linkages. I also want to say that now that the plan was adopted in COP16, and there's a request from the COP to the CBD Secretariat to support the uptake and implementation of the plan, we have also updated the portal on biodiversity and health. And then you can go to our portal, you can find the action plan there. And we have also made available a new tab on resources to support the implementation of the Global Action Plan. So if you go to that tab on resources to support the implementation, this is not the full list of areas that you will see, but if you go there, you will see a big list of areas that you can go and you can click on these areas. And when you do, then a list of resources will be displayed and you will have an idea of publications, tools, websites that you can use to support the implementation of the plan from different perspectives. And this also comes from information that was presented to SAPSTA 26. So what comes next? Now that we have an action plan, I have explained what is the purpose and the objective of the action plan. And it's pretty much a milestone. It's coherent and complements the work that we're doing with the Kunming-Montreal Global Biodiversity Framework. So what comes next? I think from our side, we have a clear request to socialize the action plan and to support the parties to the convention to implement the Global Action Plan. But we also need to continue doing efforts towards cross-sectoral collaboration and coordination, because I cannot stress more that this is a cross-cutting area and that one single actor cannot do this alone. So to conclude, I just have a reflection on the way forward. I think there are strategic opportunities to integrate the full range of biodiversity and health interlinkages and highlight the relevance of the One Health approach. And some of those opportunities to me come from the fact that we can address the common drivers of biodiversity loss, climate change, and ill health in a coordinated and a strategic manner. There needs to be multi-sectoral and transdisciplinary collaboration. We need to understand, anticipate, and address risk to health and biodiversity. And we need to maximize the use of resources by not working in isolation. So with that reflection, I think I'm going to stop here with this introductory presentation for the webinar. And I want to thank you for your attention. And I'm going to hand over to my colleague, Jackie, who is going to introduce the next speaker. Thank you.
Thank you, Marianela. I'd now like to introduce Ms. Susan Lieberman, who's Vice President of International Policy with the Wildlife Conservation Society. Susan.
And just a minute, I'm trying to load my slides and see if I can get this to work. Sorry, for some reason, it's not allowing me to go up a page. Can you hear me?
Yes.
Can you hear me?
Yes.
Yes, we hear you, Susan.
Okay, and I'm sorry, but for some reason, this isn't allowing me. There. Can you see my first slide now? Yes, thank you very much. Yes, and thank you very much for inviting to CBD Secretariat for inviting the Wildlife Conservation Society to address you today. Sorry that I'm having problems advancing my slides for some reason. It won't let me advance my slides, so for some reason, I'm sorry. There we go. So just a little bit of background, and Marianela did a great introduction. But if we look at the crises that we are facing now globally, whether climate change, biodiversity, and systemic health crises, whether we're talking about pandemics, avian influenza, et cetera, it's nature that is at the heart of that. And that nature is what the CBD parties recognized so effectively when they adopted the Biodiversity and Health Action Plan in Cali a few months ago. I think it feels like more than a few months ago, but it's just a few months ago. But to step back for a moment on some aspects of the Biodiversity and Health Action Plan. First, we need to look at some of the issues around land use change, deforestation, etc. There are hazards in the environment, pathogens, etc. But as long as habitats are ecologically sustainable, high integrity, forests are not destroyed, there aren't roads through forests, etc., that local communities are living, if you will, in harmony with nature, then there is not a risk. But the risk increases when wildlife, for example, come in contact with livestock, are removed from their habitat, go to markets, as you see on the slide, or to major urban centers. And it's that risk that has to do with pathogen spillover and health impacts that is explicit and referenced in the Global Biodiversity Plan, but framework, but also in the Biodiversity and Health Action Plan. And the action plan is quite clear that the GBF as well, that degradation of ecosystems and declines in the integrity of ecosystem increase the risk of pandemics, of zoonotic disease. And when we talk about health issues and One Health and biodiversity and health, we're not talking about human health only. We're also talking about wildlife health and the health of ecosystems. And we're talking about the fact that all of these are integrated. And we cannot look at biodiversity conservation in isolation from looking at at health issues, whether health for wildlife, health for livestock, health of local communities, etc. So briefly, just briefly, I promise, I was asked to talk about species and their habitats. So I'm just going to talk about really the first 5 targets in the GBF, even though, of course, all 23 are equally important. But the first target is about spatial planning. And for governments, particularly governments, other stakeholders are now putting together or implementing their national biodiversity strategies and action plans. When they do their spatial planning and look at issues of ecological integrity, I'm going to talk a minute about what the Biodiversity and Health Action Plan that the parties adopted, how that will help them implement this target. Target 2 on restoration of degraded ecosystem also deals with ecological integrity and connectivity, and it's extremely important. It's not just about ticking the box and saying, yes, we've now work to restore 28%, 29%, but what is the ecological integrity, the functionality, the composition of those ecosystems, which is directly related to health. And the third target that some people are most familiar with is on protected and conserved areas. Also important that this is about effective conservation and management, and health issues are directly relevant. So when we go to the Biodiversity and Health Action Plan, which I basically consider incredibly well written and a tremendous step forward, but there are a lot of challenges in implementing it. But it's important, as Marianela clearly showed, the action plan first talks about the relevance. So for those first 3 targets that I mentioned, the relevance is that reducing the loss, degradation, and fragmentation of wildlife habitats will reduce disease emergence and transmission of pathogens between wildlife, livestock, and people. We know that. We know that it's not something that parties need to think about later. Let's worry about health later. We need to worry now about targets 1, 2, and 3, but it's fundamental. There are 4 actions in the action plan for those targets. I just wanted to highlight the first action that encourages parties when parties are doing the spatial planning, restoration of areas, protected areas, conserved areas, OECMs, they need to consider the health interlinkages in that planning. They need to work to reduce and mitigate disease risks and pathogen spillover risk in their spatial planning, not afterwards, not when all the spatial planning is done and they decide what's an OECM, what's an indigenous territory. Oh yeah, should we think about health now? But as part of the planning, to look at reducing and mitigating the risk of pathogen spillover and disease to people, but also to wildlife and also to livestock. Extremely important for communities. If we look at the next 2 targets, target 4 and 5, target 4 is about protecting species, protecting genetic diversity, and halting species extinction. And that is about sustainable management practices. And if we want to conserve species in the wild, we need to consider all the aspects having to do with threatened species, extinction risk, etc., habitat conservation, but also to look at the health implications on wildlife and the health implications from exploitation of wildlife, for example, on people. On target 5, and it doesn't mean I don't consider the other targets important, but I only had a few minutes. But target 5 is about ensuring sustainable offtake, harvesting, and trade of wild species, but also ensuring that that is safe. That not only is overexploitation prevented, parties are committed to this, but parties also committed in the GBF to reduce the risk of pathogen spillover. Extremely important that parties agreed and decided on that. Sorry, for some reason my computer decided to jump ahead. That's extremely important target. And if we look at the action plan itself, this is right out of the action plan, so I'm not making up these words. But the point is that the action plan agrees that improving the regulation and management of the exploitation, the use and trade in wildlife will benefit, increase the safety, but also reduce disease emergence, pathogen spillover, etc. And it's an extremely important aspect of the action plan. And if we look at the actions, I'm not going to list all 6, it's extremely important that governments and other stakeholders in implementing the GBF and the action plan pay particular attention in their planning to this issue of the safety of the exploitation of wildlife. The action plan makes recommendations such as acknowledging the health risks from certain use practices, such as marketing and commercialization and farming of wildlife, recommends biosecurity measures, monitoring system, and policies to limit pathogen spillover and spillback. These are all extremely important, and I would argue landmark in the Biodiversity and Health Action Plan. What needs to happen, of course, is parties, as they're implementing the GBF, pay particular attention as they're making decisions on exploitation of wildlife, pay particular attention to the action plan in their implementation in order to benefit wildlife health, but also livestock health and human health. And I just want to say that we in the Wildlife Conservation Society work in about 60 countries around the globe, work very closely with our government partners on implementing the GBF, but also working very hard to work with our government and other partners to implement the action plan as we are implementing the GBF. I hope I didn't go over on time. I think I'm okay, and I look forward to any questions you may have later. Thank you very much.
Thank you so much, Susan, for that informative presentation. We're going to move on to our next speaker now, who is Christina Romanelli, Program Officer with the World Health Organization. Christina.
Thank you so much. Good morning, afternoon, colleagues, friends. It really is such a privilege to join this terrific panel of longtime partners and movers and shakers at this nexus, with whom I can safely say that we've had the privilege of working with for many years under the CBD-WHO Joint Work Program on Biodiversity and Health, in the long and exciting road, I would say, toward what became the Global Action Plan on Biodiversity and Health that was adopted at COP16. And, you know, there are many, in fact, all of the elements of the Global Action Plan resonate with WHO because it's very closely tied to many areas of its mandates. But one of the things that resonates most with me is that this is so much more than a voluntary plan. At its core, it really is an opportunity to reimagine how we protect ecosystems, how we prevent disease, how we promote health and well-being through inclusive, multi-sectoral, and multi-stakeholder rights-based action. It also recognizes the deep interlinkages between biodiversity and health, but in many ways also places equity, traditional knowledge, and cross-sectoral collaboration at the heart of its vision. So in this brief talk about opportunities, I'd like to focus on 3 of the many areas of interconnections and entry points that are often relegated to secondary considerations by policymakers, but in reality are absolutely central to successful implementation. So what are these 3? Equity, traditional medicine, and the rights and leadership of Indigenous peoples, which are, as you will know by looking at the plan, directly linked not only to the guiding principles, but also to the strategic action areas 3 and 5, and to the enabling conditions portion of the global plan of action. But why? Why should we focus on equity as a foundation for implementation? Because both biodiversity and health outcomes are fundamentally shaped by issues of equity. Who benefits from healthy ecosystems? Who bears the greatest burden of ecosystem degradation and biodiversity loss? Whose health and well-being is most compromised? And who has, if not the political influence, but the knowledge of how to manage natural resources in ways that are much more sustainable and contribute to this holistic vision of health and well-being? So one that's not just focused on disease or the absence thereof, but on that holistic vision of health and environment. So I think these are really especially important questions when we consider that based on conservative WHO estimates, 1 in 4 global deaths is caused by preventable environmental factors. But those impacts are really far from being equally distributed. Often it's those that contribute the least to biodiversity loss that bear the heaviest proportion of the health burden, and those that are also least covered by social protection mechanisms. So how can we embed equity in the operationalization of the Global Action Plan? Let's remember that the Global Action Plan also calls for fair and equitable access to biodiversity and the sharing of benefits we derive from them, as Marianela noted. It also calls for inclusive governance and knowledge sharing mechanisms, with specific attention also to the needs and voices of women, youth, and Indigenous peoples. So what does this mean in practice? It means that in practice, we have an opportunity to establish cross-sectoral platforms for co-developing biodiversity and health policies, ensuring the full participation of rights holders, not only sectors or stakeholders, but rights holders. We have the opportunity to support community-based planning and monitoring with true co-design in mind. We have the opportunity to align biodiversity and health strategies with Target 22 of the Kunming-Montreal Global Biodiversity Framework, which focuses on gender equality and participatory decision-making. So this brings me to the second area of focus, traditional medicine and biodiversity, really about safeguarding health at its roots. So the Global Action Plan does place strong emphasis on the importance of traditional knowledge systems and medicines, and rightly so, recognizing that biodiversity is the foundation of many Indigenous health practices, and that traditional medicine is often the first and only line of care in many communities around the world. Over 60% of the global population uses traditional medicine for primary or complementary care. And in some communities, that percentage is up to 80%, which rely on traditional medicine as a primary source of healthcare. And even if we consider, let's call it modern medicine, we know that over 40% of pharmaceuticals are rooted in nature, much of which has been informed, at least at some point, by the Indigenous knowledge associated with those plants, with those natural resources. So almost 2 years ago now, the Gujarat Declaration was adopted as an outcome of the very first WHO Global Summit on Traditional Medicine, which reinforced the urgency of integrating traditional medicine into health systems, ensuring the sustainable use of medicinal plants and the fair and equitable sharing of benefits, expanding the participation of Indigenous peoples in the governance of health systems. And this is a really important point. So what a phenomenal cross-sectoral opportunity to bring together the commitments made under the Gujarat Declaration and the Global Action Plan on Biodiversity and Health. The second Global Summit on Traditional Medicine is just around the corner. It's going to take place in December this year. And I think it'll be a real pivotal moment to assess progress, to elevate good practices on traditional medicine, but also an opportunity to link with the essential global instruments like the convention, like its Article 8J, like the Kunming-Montreal Global Biodiversity Framework, and the Global Plan of Action on Biodiversity and Health to maximize co-benefits at this intersection and to strengthen those linkages with traditional medicine. So how could we do that? Some examples of that could include, for instance, supporting intercultural health models that bring traditional healers and public health actors into respectful partnership, not for integration, because integration means that one is subsumed by the other. And to be honest, traditional medicine actually has far deeper roots. But setting that aside, it's about fostering complementarity and mutual learning between conventional and traditional healthcare systems. Also about establishing and strengthening community protocols for medicinal plant harvesting and biodiversity conservation. It's also about promoting knowledge exchange at the community level on biodiversity, health, and traditional medicine, and showcasing the best practices that exist to upscale and build on so many powerful examples within communities across local, national, and global platforms. So we can't speak to traditional medicine, of course, without addressing the third and final point, which is on Indigenous peoples as rights holders and leaders in the implementation of the Global Plan of Action. We know that Indigenous peoples represent roughly 6% of the global population, but we also know that they've been stewards of biodiversity for millennia and continue to be stewards of the overwhelming majority of biodiversity on Earth. Yet, they continue to face barriers to land tenure, to political participation, to healthcare access. So the Global Plan of Action clearly affirms the right of Indigenous peoples to free, prior, and informed consent. Let's bear that in mind. The need to recognize customary laws and governance systems, and the importance of Indigenous leadership in shaping and monitoring and co-designing biodiversity and health actions. And those principles really are at the heart of the Global Plan of Action, but they are also key consideration in the WHO's forthcoming Global Plan of Action on the Health of Indigenous Peoples, following a resolution that was adopted last year. And the Global Plan of Action on the Health of Indigenous Peoples is going to take a life course approach centering on those intercultural health systems and health sovereignty. So just to go very quickly over one compelling example that comes from the WHO IUCN report that was launched at COP16 on nature-based solutions for health. There are many such examples of Indigenous leadership. And in one initiative, we actually see that in an Indigenous rainforest community, Indigenous peoples were given the opportunity to co-design their own health systems grounded in nature-based solutions. And what happened with that? What happened was that that this led to measurable reductions in deforestation. It led to enhanced access to primary healthcare services tailored to local, cultural, and ecological contexts. It led to measurable improved maternal and community health outcomes, and it led to greater local stewardship of biodiversity. So this is only one of many examples that demonstrate the power of integrated rights-based approaches to advance both health and biodiversity goals. And it shows the importance of exchanging these practices across communities, across regions, to inspire learning and adaptation. WHO, this might be the good time to mention that WHO is now working with the CBD Secretariat and Indigenous partner organizations to carry out a series of what are called community exchanges in 2025 and 2026 across all 7 sociocultural regions identified by the UN Permanent Forum on Indigenous Issues for precisely the purpose of showcasing that leadership and strengthening opportunities for implementation, including of the Global Action Plan on Biodiversity and Health. One last entry point that I'll mention is through the Global Plan of Action on Climate Change and Health, which is being presented to the World Health Assembly this year. Principles such as equity and the need to work together through integrated approaches such as One Health are firmly embedded in that draft Global Action Plan. And taken together, these plans offer concrete opportunities to promote prevention at source, to integrate biodiversity and climate into resilient health systems, and to deliver on health for all in ways that are ecologically sound, culturally appropriate, rights-based, and community-led. So as we move forward from the adoption to implementation of the Global Action Plan on Biodiversity and Health, we have not only an opportunity, but an imperative to ensure that biodiversity and health strategies are co-designed with Indigenous peoples as rights holders and empowered community-led solutions that maximize co-benefits. So I will leave it there with thanks for listening.
Thank you so much, Christina. Now we'll move on to our next presentation from Lisa Crump of the Nature for Health Initiative and Fabrizio Cannavale of UNEP. We are...
Yeah, I know. Can you hear me?
Yes, we can now.
Okay, wonderful. I'm having some Teams issues. This is why I've asked my colleague Fabrizio to be putting the slides.
Oops, we lost your sound. Lisa.
Forward. Well, present today. You lost my sound. Okay.
You're back.
I wonder if I should turn off the camera. Well, maybe let me just continue and let's see how it goes. So I'm here representing the Nature for Health Secretariat, and I'll start with a brief introduction to Nature for Health. We call it N for H for short, and then I'll turn over to my colleague Fabrizio Cannavale with UNEP, and we'll take a closer look at some of the country work that's in progress, which illustrates synergies with the Global Action Plan. Next slide, Fabrizio. Thank you very much. So what is Nature for Health, N4H, and what are we doing? So I would say try to take yourself back to 2020, 2021, when we were all in the midst of the COVID-19 pandemic. And we've heard already about the Global Action Plan early drafts and the progress of it. There were many discussions surrounding the development and identification of the sticking points, and that's really what motivated discussions between a few, I'll call them visionary thinkers in the health and environment space. I won't name them here, so we can't give them credit nor blame depending on your perspective, but in any case, Following these discussions with some key actors, Germany, specifically through their environment sector, rapidly and generously allocated some funds that ultimately established Nature for Health. Nature for Health is structured as a multi-partner trust fund, and it was initiated, like I said, in 2022 to promote country-led preventative policies and investments in nature that will help to reduce health risks. And the overall focus of N4H is to address the environmental determinants of health and strengthen integration of the environment into One Health approaches in order to secure the health of ecosystems, animals, plants, and people. And the uniqueness of N4H, conceived as it was during that devastating pandemic, is really a focus on primary prevention rather than reactive response. And you've likely heard that an ounce of prevention is worth a pound of cure. And certainly with regard to zoonotic diseases that have pandemic potential, this means stopping the spillover of disease from animals to people, which necessitates, as we've heard from Susan earlier, considering the environment and those surrounding ecosystems. There are two more must-haves in the context of N4H, and that is a focus on catalyzing actions on the ground, so implementation really of these integrated approaches to health in countries. And in order for the actions to be sustained, there's a need for synergy between these local, on the ground owners and knowledge holders and the broader community, which has additional technical knowledge. And this means enabling and even insisting on participatory methods throughout. Next slide. So, next slide, please. Thank you. So currently, the entirety of N4H's funding has been contributed by the German Environment Sector Ministry, which specifies two additional uniquenesses for N4H, and those are that funds are not funneled directly to government entities, but I should note that about 70% of all the monies are designated to be spent in country through various subcontracting processes. And I don't want to spend a lot of time on it here, but it is an important distinction to be clear. The other boundary set by the current funder, which is Germany's International Climate Initiative, is that the funded work relates to pandemic prevention. And this means that the country projects funded in the first phases are centered not just on upstream prevention to reduce those health risks, but more specifically considering zoonotic diseases. And certainly Nature for Health partners are working to secure additional donor countries and entities to this multi-partner trust so that the scope of the work thematically and in number of countries supported can be expanded. Next slide. So what are we exactly doing? What do we aim to be doing in order to reduce these health risks and their related impacts by implementing such preventative One Health approaches and address the environmental drivers? Well, there are four main areas of focus for Nature for Health work. Building the body of evidence through multidisciplinary research, enhancing preventative actions and hopefully policies in order to impact some downstream activities, building necessary capacity both directly and also through dissemination of the generated knowledge, and lastly, facilitating sustainability by strengthening connections for effective collaboration, including structural improvements and innovations. Next slide. So how are we anticipating doing this work? Well, we need to bring diverse actors together, and this is complicated, but there are always resource limitations. It might be through time, it might be through prioritized funding, maybe there's a lack of commonality and purpose, and many of us who are working in technical areas can be deeply entrenched into our silos of understanding. In order to address these issues, Nature for Health partners worked with experts on learning to develop a stepwise approach for countries to implement a scoping process so that they could explore, identify, and elaborate their own specific implementation project. And I don't have time to dwell on it more, but if you're interested, there are details on the Nature for Health website, and this guide is freely downloadable, and you're welcome to take a look there. Next slide. just briefly, the Nature for Health timeline, because much of what they're attempting to do is novel, and you should understand that novel is just another word for untested. We decided to use a phased approach to hopefully capitalize on the lessons that were being learned throughout the project. And so we're chronologically right now about a third of the way through. There are 6 phase 1 countries, which Fabrizio will tell you a little bit more about in a few minutes. They're moving towards implementation, and we're just starting the second phase. Based on the currently secured funding, we anticipate selecting another 6 countries in phase 2 work and 2 more in a last group of 6 in phase 3. Next slide. So some of you may be aware that we have an open call for expression of interest. It was meant to close yesterday, actually, but we extended it for an additional 2 weeks due to some continued interest and specific requests from different partners. And so the new, and I do have to say, I think final closing date is now Monday, the 7th of April. There will be another series of informational webinars in May. Those are aimed at applicants specifically and to update on the next phases, the next steps of phase 2. It's the Nature for Health Steering Committee who have the responsibility for selecting, and then those participating countries for phase 2 will be announced in summer. Next slide. So Nature for Health projects are implemented only in overseas development assistance eligible countries. They are at the invitation of these countries' governments. And political will and commitment from the government decision makers to engage really throughout the project cycle are demonstrated through the letters that they submit from relevant key ministries stating their endorsement to support a Nature for Health initiative. And these can include any ministry sector, but at minimum, they have to include the Ministry of Environment or its equivalent in the country and the Ministry of Health. And because the government priorities need to be in the central position for Nature for Health's vision to be sustainably implemented, non-governmental organizations are not eligible to initiate the project application, although they certainly are supporting countries with technical and other aspects. Next slide. So I have to beg your pardon on this slide because we were requested to finalize our slides by last Friday. These numbers are not reflecting real time, but I can say that as of this morning, there were 40 applications received. We haven't managed to further assess them, so I can only give you this incomplete data and say that you're really invited to register on the Nature for Health website to attend one of the information webinars in early May, and there will be many, many more details. So we do have applications from diverse geographic areas already, I can tell you that, and the anticipated ministries are of course already reflected in the applications that we've reviewed. So if phase 2 turns out to be anything like phase 1, the relatively short list that I'm showing you today will certainly grow considerably. And next slide. What the steering committee will be looking for from desirable country partners to undertake future Nature for Health projects are a demonstration from government leadership to support their engagement in the Nature for Health process, as well as an understanding that the work is focused on upstream prevention efforts rather than response activities, and a willingness to work intersectorally in equity, as well as openness to collaborate and an eye towards new things. We are looking for actively engaging a diversity of relevant stakeholders across the projects, and Nature for Health partner organizations will contribute respective technical expertise and experience, but it can't be predetermined which partners will be working in which entities. So I'm going to stop there in the interest of time and hand over to Fabrizio to tell you more about the country work to date and where we envision synergies with the Global Action Plan for Biodiversity and Health. Fabrizio, the floor is yours.
Thank you, Lisa. Can you hear me?
Yes, we can.
Perfect. Thank you so much. Yeah, so as Lisa was mentioning, as part of like the first phase of Nature for Health, 6 countries were selected. Here you can see 4 of them, which are the ones that we're going to talk a little bit more about what they are doing and how this is connected to the Biodiversity and Health Global Action Plan. Something to highlight as well is that the countries selected also reflect and ensure that there's regional balance when they are selected. And as you can see here in the squares that are shown for these 4 countries, there are information from their application process, which in the implementation and scoping process, these areas that they applied with were started getting in shape with the systemic approach that they need to apply. But some of the things that you're going to see reflected there are the anthropogenic activities that threaten biodiversity occurring in those countries, how their countries has implemented or integrated approach at the moment, and what interfaces or issues need to be proposed in order to prioritize nature for health actions. As I said, also, it's important to ensure the systemic approach throughout the implementation of the process. And also interesting to see across these 4 countries that we selected to show you more information about are the diversity of the ministries that are part of the project, right? So at the moment, there's a need of joint application from the Ministry of Environment and Ministry of Health, but of course, if more ministries want to get involved into the application process, they are more than welcome, because that would strengthen also the intersectorial approach that we want to get. And in these countries, you can already see ministries for environment and health, but also agriculture, livestock, education, among others that are involved in the projects. We're going to talk a little bit about Ecuador and the 5, in order to create their or to start their implementation process, they did 5 participatory workshops in different cities, including 2 roundtables with indigenous communities that lived across these cities in the country. And some of the activities that they will implement are specialized epidemiological surveillance at the Ministry of Environment and also integrated surveillance with the Ministry of Agriculture and Health. And will activate the Interinstitutional Response Committee and strengthen diagnosis capacities through partnership with public and private laboratories. This seeing that one of the more one of the challenges that they see in the country is communication between sectors, the One Health sectors in the country. In Ghana, for example, we have the systemic approach applied across 4 regions in the country. And there are 5 areas that the project will be addressing, which includes advocacy activities, surveillance and risk assessment, risk reduction policies, and One Health coordination among sectors that would also support strengthening the monitoring, evaluation, learning, and outreach at the country. In Mongolia, which is one of our Asian countries applying or implementing Nature for Health, the project is aiming to respond to the urgent need of enhancing the One Health coordination and strengthening policies to foster sustainable adapted behaviors towards wildlife and environment. And some of the actions that they plan to implement includes engaging with communities into wildlife health and monitoring, and increasing knowledge of diseases at the environment, human and livestock interface, while exploring nature-based solutions adapted to local context. Something that is really important from these country projects that I'm showing you as well is not just the focus on the environmental dimensions or the environmental determinants of health or of zoonosis, but also how communities are always included. And one of the main ideas of Nature for Health is also fostering that the ministries, the government, would also provide sustainability to these initiatives that are going to be developed. And in Vietnam, for example, we're also working with wildlife trade, which is recognized as one of the high key risk to the One Health action plan in Vietnam. And it has been recognized that there's a lot of problems with the stressed wildlife that are transferred to rescue centers based on the illegal wildlife trade that the country has, And one of the key components that Vietnam wants to work are, again, testing models to enhance cooperation to address these issues, including local governments, including working with local governments, also design and test protocols in rescue centers to reduce disease risks and accelerate reintroduction of healthy animals back to the wild. and implementing or in strengthening the One Health partnership. These activities also contribute to the Biodiversity and Health Global Action Plan. In summary, to these three targets, to the target 4, 5, and 9, on which are part of the bigger scheme of reducing threats to the biodiversity and also meeting people's needs through the sustainable use and benefits sharing. And to more specific actions, specifically talking about pandemic prevention, preparedness and reduction, are actions 4 and 5, which have a focus on human-mediated factors with high potential to drive transmission of zoonotic diseases, and also reinforcing planning and surveillance of biodiversity, including wildlife habitats and zoonotic pathogens spillover risk, with having in mind the One Health approach to its implementation. So if you want to know a little bit more about what our countries are doing, we once again invite you to visit our website, where there's more in-depth information from each country's implementation at the moment. And yeah, if you have any question, feel free to also reach out to us through this email. Thank you so much.
Thank you so much, Lisa and Fabrizio. We'll now move on to our next presentation, which is by Catherine Machalaba, and of the Planetary Health, who is a planetary health scientist at the Nature Conservancy, who is joined by Ures S. Goal of the Society for the Conservation of Nature in Liberia.
Thank you so much, Jacqueline and Marianella. Hopefully you can hear me. Hopefully the connection's all right.
We hear
Okay,
you
great.
just fine.
Great.
I'm going to share your presentation, if that's okay.
Excellent. Thank you. And I will probably keep my camera off. I'm in a beautiful village in northern Kenya, but I just want to preserve the bandwidth. But thank you so much for that opportunity. And I will start, and then I'll turn it over to my esteemed colleague, Uriah Skoll. But we are very excited to really look at some of the global tools that are being used to inform national actions from a One Health lens, specifically in protected and conserved areas. So if we go to the next slide here, I think we're very familiar with this One Health visual that the One Health High Level Expert Panel developed and has the endorsement of the 4 agencies that you see on the screen, including the UN Environment Program. What I think we often maybe don't see is the One Health definition foundational principles, and I think these are so relevant when we look at the Global Plan of Action for Biodiversity and Health, thinking about equity between sectors and disciplines, and making sure the environment sector is really strongly represented when we talk about decisions that really need a One Health lens. The socio-ecological equilibrium, really that interaction between humans, animals, and environment. We heard in the previous presentations why that's so important. And the intrinsic value of all living things within the ecosystem. Again, these are things that are not inherent in a health lens always, and really needs that input from biodiversity and related fields to really make sure this is brought in strongly. Of course, stewardship and modern and traditional forms of knowledge, and really that representation, that equal representation, the free, prior, and informed consent. So really thinking about, again, how important it is to have the biodiversity sector at the table in One Health decisions. If we go to the next slide, I'm very excited that the Nature Conservancy, as the largest conservation non-governmental organization in the world, working really across many countries. We work in 81 countries and territories very closely with partners, and I think when you look at this vision about a future with a livable climate, healthy communities, and thriving nature, what really motivates me is that healthy communities are really at the core. And so there's the health aspect, there's the community aspect, really the benefits to people from nature protection. And as we really think about how health and well-being underpin our ability to play active roles in conservation and climate action, and see a brighter future, we also think about how biodiversity underpins our health, and really the ways that we can live and use resources and engage with conservation. We need to be healthy to really be fully active in conservation efforts. If we go to the next slide. So TNC has very ambitious 2030 goals, and of course these contribute to the global biodiversity framework and the achievement of the critical 23 goals. And what I see here really when we think about something like in the Biodiversity and Health Global Action Plan, really looking at those national assessments of biodiversity and health linkages, we're really working together on this. So we are trying to do this within TNC. I hope we have many opportunities to partner and really look across these different actions. And if we think about how these relate to different targets, I think we see many points of overlap and synergy, but really thinking about how do we identify and in some cases quantify the benefits from nature conservation to people through a health lens. I think there are many examples, and if we go to the next slide here too, we can see some that we've come across already. So of course, drinking water and adequate water supply for people through watershed protection. We know the importance of it. We know we need to scale up freshwater ecosystem protection to really benefit people and ecosystems in a long run, especially under climate change conditions. Thinking about heat exposures, really rising risks and impacts of heat, high heat, extreme heat, and how nature can provide a cooling protection benefit. Smoke and air pollution, so managing forest fire risk through prescribed forest burning, urban greening, for example, restoration, and then management of crop residue, so alternatives to burning of crop residue. So you have the benefits for climate, you have the benefits for ecosystem management, and you also have very localized and potentially further afield benefits for respiratory health, for example. Mental health challenges, and also critical health infrastructure, really the benefits that coral reefs and mangroves provide for our critical health infrastructure, among other infrastructure too. And then what I'm really seeing here with our colleagues in Northern Kenya, how reproductive health services, so specifically family planning, child spacing, really the decision-making and access to health services, really how that can be at the community level a really vital entry point to the health system, and how that can support communities and conservation stewardship really creates this ownership related to conservancies, and it delivers this direct benefit that relates to how people use resources now and in the future. If we go to the next slide here. So just getting into some of these tools at the global level. So integrating health into biodiversity tools. I'm very excited that we are doing that at TNC. So things like financing mechanisms, we know how important that is for biodiversity and health. But looking at nature bonds, for example, and the very exciting investment that we saw in Ecuador, thinking about how One Health can really be integrated into that, and also in the decision making about what to finance and how to finance it. And then looking at nature-based, so this is specifically focused on natural climate solutions, but then also looking at co-benefits related to biodiversity, and we could also add in a health lens. I also just want to say, really, as we're making these decisions, there has to be this bottom-up, really led conservation approach. So I think these tools, the voice, choice, and action framework, this is something that we are using within TNC. It has had very good success in the past few years. And what I think is very exciting here, if you look, I know it's a little bit small, we can put in the chat the link, but something like foundational element 3, durable outcomes for people and nature. I think health is such a durable outcome. Everyone cares about their own health or their family's health or their community's health. And so it's something that you can engage people directly with. And I think there's a lot of synergies with the biodiversity interventions as we've discussed. If we go to the next slide here, I'm very excited that the One Health tools for integrating, tools to operationalize One Health in protected and conserved areas. I know several of our IUCN colleagues are on, and we have developed these tools really for protected and conserved areas to include a One Health lens in their site management planning, in their tourism activities, and then really looking at free-ranging wildlife. And what I just want to say here is that if we think about surveillance of diseases, pathogens, and toxic agents, so chemical poisoning, for example, and free-ranging wildlife, there might be a human component. There is certainly a biodiversity component, and we really need to think about wildlife health for biodiversity's sake too. So I'm very excited to turn it over to Urias to talk more about how these and other tools are really being operationalized in Liberia and the lessons that we can learn from Liberia. Thank you. Over to you, Urias.
Thank you very much, Catherine, and hi to everyone. Sorry for my background noise. I'm attending the workshop. In fact, I'm facilitating the workshop, so I have to take a quick break. and then to come and join this call. As Catherine said, I mean, there's some great ideas and tools, international tools for biodiversity, One Health, and protected area. But in Liberia, there are 4 things that I'll talk about how we sort of manage to build that concept into at the national level. The first thing we realized that if you want to, promote an international tool or just bring up the idea of, how do we promote One Health in protected areas? The first thing you have to build the linkages that's been built globally between biodiversity and health and One Health, but also find local examples. That's important because if you always use an international, research, international example, sometimes it's faster to build that knowledge or build a consensus with locals if you have a local example. So one of the things we did was to conduct, research or an assessment on mining, the illegal mining activities happening within one of the protected area. And it's called the Sino National Park. And we realized that these folks were using mercury. So some of the rivers, the water samples we took from the rivers had, increased concentration of mercury. And the fish population was definitely affected. And that relationship between the fish population and, people who are harvesting, catching fish for protein source of food would definitely over time, which we didn't do the research, but there's already been linkages over time will be impacted. So those kinds of examples can generate interest. The other one we're doing that did not, come to a conclusion, we're doing an analysis of how ecological change or land use change over time can increase not just diseases but also the cost of healthcare in the country. Those kinds of examples, once you build that link and show people, you motivate and generate interest. The other thing that we realize is that to promote One Health in protected areas is to build an institution and policy setup to make sure that it's there. That doesn't mean you have to create a new policy or a new law, or build new institutions. You just have to, I think one of the speakers said it, you have to build strong collaboration. So Liberia, with the experience from Ebola, had built a very strong national One Health coordinating platform, which is working. But one of the mistakes that we've noticed is that the One Health coordinating platform is at the national level. Information doesn't get down to the community or district level. So there's a county health team. We realized that on the county health team, you don't have rangers who are protecting these protected areas, who are engaging into, animals that are sick or animals that have died from, for example, from a particular disease, and people go and collect the carcasses and eat them sometimes, or use them. So these rangers who are reporting these things will have to be on the health committee. So that if they see or they're trained, if they see this kind of situation where an animal is injured or distressed or is bleeding, they could report, or maybe it's captured for some, reason because it was sick. They could report that information to the county health committee, which then would take over the situation to investigate potential One Health or public health, emergency. So once we started training the rangers and we talked to the health committee and said, look, you have to bring the rangers on the committee so that there can be a collaboration at local level. That's one of the ways we feel that information interest can be generated. The other way we impacted policy was that, like I said, you don't have to build a new policy, but whenever there's a change or an update of a policy, there's an opportunity to include One Health or public health provision. So one of the ways we influence policy in the country was when the ESIA, Environmental Social Impact Assessment regulation, was being updated. We provided some language for One Health provision there. Also, the wildlife law was being amended just about the time that we were trying to influence policy in the country. And we had some, with the help of Catherine and some of the other colleagues, we were able to influence some language and provision into the amended wildlife law. And also what we did was that they revised NBSAP as a result of, the GBF when the government was revising the NBSAP. We work with the government, we influence that process to have at least a target on One Health, right? And that target contains other sub-targets on or intervention on One Health in protected areas. So those are the different ways we realize that you can influence policy to be able to promote One Health in protected area. If you move to the next slide, please. The other thing that we realize is that capacity building and training is very important because One Health itself, it might be a concept that people know globally, that people know for the last couple of years, but you'll be surprised locally, there's very limited knowledge. on One Health or One Health and protected area. So training and capacity building is important. We realize that one of the things we've done is we did regional training around all of the protected areas in Liberia on, One Health and protected area, what rangers to do, how rangers to engage, with the communities, but also engage with animals that are distressed or sick. If they see a carcass, animal carcass in the park, what do? Do you engage? Do you just, collect it or alert the health authority to find out why this particular animal is dead, say because of a particular illness, and how do they go around creating a system whereby communities and rangers are working together and the health authorities are working together. The other thing is to get the young people involved, build their capacity. They're champions. Most of these places where protected areas are established, the population is always more young people. And sometimes they're the ones engaged in the mining, the illegal mining activity, the illegal access, and some of them are involved in hunting. So once you train them on the benefits of One Health in protected area, they can, be champions. The other thing I would say about capacity building is that the smart technology, I don't know how much you know, but it's a technology that rangers use for, law enforcement. We realized that as they're collecting law enforcement data, within the park during the patrols, there was no indication of collecting data on One Health. If they see an animal is sick, they don't record it because there's no space within the technology. So we work with them to include those One Health consideration into the technology. And the last thing I'll say is that awareness and messaging is very important. What we realize is even though we have these One Health days that we bring in partners to talk about it, but one key factor we brought into the establishment of protected areas is that the messaging for free, prior, and informed consent during the creation of the protected area should have a One Health message and a One Health consideration. So all of our messages now, during the FPIC process for the establishment of protected area, we've included, the importance of One Health in protected area. So based on those four, learning outcomes that we've seen, I think it's useful if somebody is trying to build or, notch, domesticate or sort of, bring in a localized and international tool to promote One Health in protected area. Thank you.
Thank you so much, Catherine and Uriah. So interesting to hear about your efforts on the ground. Our final presenter is Paula Prist, who is coordinating lead author of Chapter 2 of the IPBAS Nexus report. Paula?
Hi, everyone. I hope you can all see my screen. So I was one of the coordinating lead authors from the IPBAS Nexus report, and today I'm going to talk a little bit, just a little, because it's a huge report about the biodiversity and health findings. And I think it's not new to anyone that we are living longer, like people are living more years. And we can clearly see this by looking at those graphs where we show that child mortality rates and child malnutrition, they are decreasing over the past 50 years, while life expectancy is increasing. However, it doesn't mean that just because we are living longer, we are also living a healthier life. At the same time that we are living more years, the prevalence of non-infectious chronic disease has increased, diabetes and obesity have escalated, and mental health conditions have also significantly increased. And just to give one example, infectious disease, they account for almost 16% of all the deaths globally and 44% of the deaths in low resource countries, which is a lot. So we are living more years, but we're not living a healthier life. And as everyone already mentioned, the same drivers that cause biodiversity loss, they are also the drivers that negatively affect human health. And as the IPBAS Global Assessment identified, land and sea use change, unsustainable exploitation, climate change, pollution, and invasive alien species, they are all causing biodiversity loss, but also negatively affecting our health. And they are all presenting positive trends over the past 50 years. So they are always still increasing. And I don't know if this is clearly to see, but for me it is after 3 years of working on that. So we can clearly see that all those direct drivers, they are negatively affecting both physical and mental health. So those yellow colors and pink purple color here, they show that all those direct drivers, they are negatively, strongly, or moderately directly impacting human health. And just to give a few examples, land and sea use change and unsustainable exploitation, for example, is also identified as one of the main drivers of infectious disease emergency. In fact, it is linked to almost 30% of the new infectious disease reported since 1960, despite all the other impacts that we also see when we replace a natural habitat and we lack the green space that is also going to affect physical and mental health. Climate change has several direct impacts on human health, and just to mention a few in here, we can clearly see heat stress in our body when we have a heat event. I don't know if you ever suffered that, but 2 years ago I was in Brazil during a heat event and my body started feeling heat stress, and it's really, really, really dangerous. We also have the direct loss, like people they lose their lives on those extreme events, even if it's on heat events or floods or wildfires, and we have several other direct impacts from the extreme events. Besides that, climate change is also increasing stress and anxiety, which is a lot linked to those extreme events. And of course, is also affecting the range and the burden of infectious disease. And personally, I always say that climate change is going to be catastrophic for human health if we don't do something now. Air pollution, for example, is linked to 9 billion premature deaths in 2019, which represents 16% of all deaths worldwide. And this just to mention one type of pollution. I'm not even bringing the direct impacts that pollution has on the loss of water quality, food quality, and other types of pollution that also negatively impacts our health. And 85% of the invasive alien species, they also negatively impact our human health and well-being. Some of those very famous vectors and hosts of disease, for example, they are invasive alien species in some regions, as the Aedes aegypti in South America. And besides that, we also end up changing some very important landscapes, and we end up losing some cultural services that are really important for human well-being. So what we see is that those direct drivers, they are directly and negatively impact both the physical and mental health. However, because those relationships, they are really complex, those direct drivers, they are also impacted, they are affected by the indirect drivers, which are economic, demographic, institutional, cultural, technological, and etc. And those indirect drivers, they also have a negative impact on human health, as we can see in here on those red arrows. So this means that human health is being negatively affected, not only by the direct drivers of biodiversity loss, but also by the indirect drivers. So we are suffering all the burden from those drivers. And these, I'm not even mentioned the cascading impacts that we have when one of those drivers, they are just affecting one of the other nexus elements, which is biodiversity, water, food, or climate. And we have cascading effects on human health. So just to give one example, don't pay a lot of attention on these arrows because it's the overall effect. But if we have land use change happening to include or to increase the food production of a place, this can have negative impacts on water quality and quantity. This can exacerbate climate change, and this can cause biodiversity loss. And all of this is going to also negatively impact our physical and mental health. So the data is really clear. What we're seeing is that if we keep doing what we are doing, and if we don't change our current trends, we are going to have catastrophic outcomes, not only for biodiversity, water, food, climate change, but also for our health. However, there is a way out, and the analysis shows that if we focus on protecting nature, on effective conservation and restoration, on sustainable management of natural resources, pollution reduction, and climate change mitigation and adaptation, we can have positive benefits, not only for biodiversity, water, food, but also for health. So based on that, the report identified 15 response options that were related to health. And they were selected because, among other several criteria that I'm not going to mention here because we don't have time, but they were selected because there is evidence that they can be implemented. So they are feasible to be implemented, and they have a potential for transformative change. And they not only have a positive effect on health, as we can see here, but they can also have a positive effect on biodiversity, water, food, and climate change, as we can see by this green, and the darker the green, the better the positive outcome. And not only that, but they can also help in the achievement of the Sustainable Development Goals, the Global Biodiversity Framework targets, and the Paris Agreement. And I'm only going to give a few examples, but some of them, for example, they are more related to changing the healthcare system. So, for example, the Net Zero Sustainable Healthcare, focusing changing the practice and increasing prevention and community care to make sure that we can reduce the need for hospitalization. And as a consequence, this is going to reduce the healthcare carbon and environmental footprint and reduce CO2 emissions and pollutions, and is going to have a positive effect on health, on biodiversity, on climate change, and etc. The sustainable use of medicinal plants and nature prescription, which is really aligned to what Christina was mentioned before, is really try to include this use in the healthcare system that is not only going to positively affect our health, but also positively impact biodiversity, climate change, pollution, and etc. And some of the other response options, they are more related to the conservation per se, which is increase the mangrove conservation and restoration, for example. And this is going to not only conserve biodiversity and purify water or provide food and plants, but is also going to avoid hazards from coastals such as flooding, storms, tsunamis, and etc. And it's going to end up also positively affecting human health. And the same for conservation and biodiversity management of zoonosis. So those are just a few examples, but in the assessment, we identify more than 70 response options. And the majority of them, they have a positive effect, not only on biodiversity, but also on health. And they range from conservation, management of ecosystems, and etc. And I won't enter in any detail in here, but I invite you to please download our Summer for Policymaker and read in detail all those 71 response options, because you probably are going to see one or two or 5 or 10 options that can be really applied to your context. And I just want to say thank you to the amazing group of authors. We were more than 150 people, and I'm here to answer any questions. Thank you.
Thank you, Paula, so much for such an excellent presentation. I think this brings us to the end of the presentations. We still have 5 minutes, so I would like to take one of the questions. This question is for the colleagues from Nature for Health. Basically, recognizing that from the presentation, we can see that work is happening mainly on agrarian communities. And the question is if urban communities are also included in the work that Nature for Health is doing. So I want to see if Lisa or Fabrizio can take that question before we close very briefly. Thank you.
Hi, I can take the question, and thank you indeed for asking it. I think like for us it's of course important to recognize that local communities and indigenous communities are involved in the systemic approach process because they are closer to biodiversity. But of course, the wider community in general, and cities and societies are also involved in the process. It always depends on how the ministries and the project generation process is going to involve different stakeholders and which are more relevant to the main objective or outcome that this process wants to achieve. So yes, they are also involved, but of course in at least for the countries that we have showcased at the moment, it has been more relevant to include indigenous and local communities.
Thank you, Fabricio, for that. We have a few more minutes, so I just want to refer also to another, more a comment that we receive of the importance of bringing also the buy-in of getting the buy-in of the health sector, because probably with the adoption of the Global Action Plan under the CVD, it can be interpreted as a goodwill and a lot of interest from the biodiversity community to connect. So this is something that I would like to address jointly with Christina, if possible, very briefly in a minute. From my side, I just want to say that I think we both recognize the need to continue to work together. Definitely, as I stressed during the presentation, this is a cross-cutting issue that no single actor can address alone. And I think now parties or countries are in the driving seat because they are the ones setting the agenda for these multilateral processes. But we from the Secretariat and from WHO clearly stand ready to continue networking and facilitating the process of mainstreaming these linkages. But Christina, over to you if you want to compliment. Thank you.
I wholeheartedly agree with you, Marianela. We continue to stand ready to support all partners that are interested in, and I hope all partners are, in implementing the interlinkages between biodiversity and health. There are so many things that we can say, and there's so many areas in which we've been working, of course, over the past 2 decades. One of those is One Health. We also work under the Nature for Health project, of course, to implement that. But one of the things that I want to say is something is drawing upon what you said, Marianela, and it's about we really need to bring the health sector in. Well, the only people that can really bring the health sector into this narrative, so that give us the mandate. These mandates are terrific and so important within the CBD Secretariat, but they also have to trickle through to the World Health Assembly, because there we also need to be talking about the value of prevention at source. We also need to be talking about the global plan of action on biodiversity and health. And so I think every single one of the people on this call here can approach their health ministries and liaisons and make the case, because the case makes itself. But please do so, and we stand ready to support. Absolutely.
Thank you, Christina. Thank you very much. I think with this, we have exhausted our time for today. So I hope that the information that was presented today is going to be useful for the audience. And I want to take the opportunity to thank once again the representative from the other organizations, the speakers that for their great presentations, but also for sharing their time with us today. So with this, the webinar will be closed, and thank you once again for attending.
Thank you.
Thank you.